Coronavirus disease, or COVID-19, is an infectious disease that can affect the lungs and airways. As COVID-19 is a new disease, there is no direct clinical data or research that supports best management at present. Management, therefore, is determined at this stage from best practice, experiential report, and careful extrapolation from appropriate clinical scenarios and associated pathologies. So, what do we know about this disease? We know that patients develop a range of respiratory symptoms and systemic alterations in leukocyte and cytokine levels. This may lead to adult respiratory distress syndrome, or ARDS. We also know that at present, there is neither a vaccine nor a medicine available to treat the disease. Management strategies specific to COVID-19 are still being decided, with management currently based on symptom presentation. In severe cases, management may result in the need for mechanical ventilation and sedation. Though our collective experience with this disease is limited to what we have seen thus far, we do already know the long-term effects of ARDS and ventilation: increased mortality, decreased life expectancy, decreased health-related quality of life, neuropsychology disability, radiological lung alterations or pulmonary dysfunction, and physical deconditioning, which results in fatigue or weakness or both. We also know there are long-term effects following respiratory support. We know that, post-intensive care, patients present with mild to severe impairment of physical and mental health. 22% of patients experience mild symptoms, 39% experience moderate symptoms, and 15% experience severe symptoms following respiratory support. High-level evidence has determined that endurance and resistance training will reduce dyspnea, increase tolerance for exercise and daily living activity, significantly improve health-related quality of life, reduce anxiety and depression, and improve lung function. Ongoing rehabilitation is essential for many COVID-19 survivors after discharge from the hospital. Physical therapy is critical to this continuity of care. However, in the current environment, face-to-face care is less viable due to guidelines and restrictions around social distancing, enactment of quarantine and rest-in-place measures, and increasing demands on the healthcare system. Salaso Health is a secure service that allows you to continue person-centered care remotely. Using Salaso Health, providers, physical therapists, and assistants can reach out to patients using telehealth and assign exercises while on the call. After you initially set up your Salaso account, simply log in, add your patients, and schedule a telehealth call. During the call, you can prescribe evidence-based exercise protocols in the form of HD videos that are developed by Salaso specifically for COVID-19 rehabilitation. The exercise protocols are informed by the American Thoracic Society and the European Respiratory Society guidelines. These organizations are working together to issue joint statements relating to COVID-19 on behalf of WHO. Visit salaso.us for a more comprehensive view of the many features of Salaso Health. Request a demo of Salaso Health now.